What if I told you that a grade 4 glioblastoma brain cancer diagnosis doesn't always mean a death sentence? This paper blew my mind. Today we'll be discussing a published case report of a woman with glioblastoma multiforme who remains in stable remission 7 years later. After discontinuing chemotherapy, she used a combination of ozone therapy, high-dose melatonin, and medical cannabis. I want to break down exactly what was done, what we know, and just as importantly, what we don't know. This video is for educational purposes only, not medical advice. Always consult your oncology team before making any treatment decisions. First, let's briefly explain why GBM is so difficult to treat. Glioblastoma multiforme, or GBM, is the most aggressive and devastating brain cancer known in medicine. It also has one of the shortest survival times of all cancer diagnoses. Even with surgery, radiation, and chemotherapy, average survival remains around 12 to 15 months. GBM is so hard to treat for a number of reasons. 1. The tumors don't form a nicely contained lump. The cells tend to infiltrate deeply into the surrounding brain tissue, making complete surgical removal impossible without severe brain damage. This leaves behind thousands to millions of cells that can cause a tumor recurrence later. 2. As with all brain cancers, the effectiveness of chemotherapy depends on the ability for the drug to cross the blood-brain barrier. This severely limits the number of chemo drugs that can have an effect. Furthermore, the doses needed to achieve sufficient tumor penetration often cause significant toxicity in the rest of the body. 3. Extreme genetic and cellular heterogeneity. The cells within the same tumor can have vastly different mutations, growth rates, and sensitivities to drugs. This makes targeted therapies hard to use as they may target a single pathway or mutation, killing some cells but leaving many untouched. The cells left behind then develop resistance to treatment and cause tumor recurrence. 4. Glioma stem-like cells. These GBM cells behave like stem cells. They are self-renewing, highly resistant to radiation and chemo, and non-replicating, which makes drugs miss them, as chemo usually only kills rapidly dividing cells. They can then reseed tumors and cause recurrences. 5. GBM tumors actively suppress the immune system in their microenvironments, making it harder for the immune system to recognize and kill cancer cells. This is one reason why immunotherapy results in GBM have been so disappointing compared to other cancer types. 6. They are also very fast-growing tumors, which just complicates things further. For all these reasons, despite decades of research and millions invested, the survival time of GBM patients is dismal, and it remains one of the hardest cancers to manage. Now let's walk through the actual case step by step. The patient's first CT scan in August 2016 showed two tumors measuring 52 by 41 millimeters and 40 by 20 millimeters, respectively, both located in the frontoparietal region of the brain. She underwent surgery in August 2016, but a full resection of the tumor mass was not possible, leaving behind a 2 centimeter tumor. The pathology report revealed that the tumor was MGMT methylated and wild-type IDH1. The methylated MGMT would suggest a good response to chemotherapy, but the wild-type IDH1 status predicts a worse prognosis and more aggressive tumor type. After surgery, the patient underwent brain radiation to the tumor area. Unfortunately, the paper does not specify whether or not the radiation had an effect on the remaining tumor, as no scan was mentioned after radiotherapy. Following the standard treatment for GBM, she then began treatment with temozolomide chemotherapy, taken for 5 consecutive days once a month, usually for 6 to 12 months total. However, after the first cycle, she refused to continue due to thrombocytopenia, a low platelet count, and she experienced significant personal side effects. Instead, in November 2016, the patient started an alternative therapy protocol consisting of ozone therapy, high-dose melatonin, and medical cannabis. Ozone therapy consisted of the rectal administration of 97% oxygen and 3% ozone for 2 daily administrations with an interval of 6 hours between sessions. She did this for 4 consecutive days per week for the first month. On day 5, a blood count was carried out, and at the end of the first month, a complete biochemistry was done. For the following 2 months, the treatment remained the same. At the end of the first 3 months of ozone therapy, the patient discontinued the treatment for 3 months, but the reasons for this are not mentioned. The therapy was then restarted and maintained until the writing of this paper, reducing the weekly sessions from 4 to 2 and alternating between 3 months on treatment and 3 months off. Melatonin was administered orally, initially at a dose of 100 milligrams once a day, and then increased by 100 milligrams every 4 days, up to a maximum of 2 grams daily. Since this was taken once daily, I think we can assume she took it all before bed, although the paper doesn't specify. It's worth emphasizing that this dose, up to 2 grams per day, is orders of magnitude higher than typical over-the-counter melatonin use and was administered under medical supervision. In terms of medical cannabis, the patient began with an initial dose of 50 milligrams of bedrolite 4 times daily. This medication is 9% CBD and 0.4% THC. In addition, she took 100 milligrams of Bedrocan 4 times daily with 22% THC and CBD below 1%. The paper states that the doses increased over 2 years to between 1 and 5 grams daily for each preparation. From 2019, Bedrolite treatment was changed to 100 milligrams 4 times daily during the ozone pause phase and 50 milligrams 4 times daily during the ozone therapy phase. At the end of the first 3-month cycle of ozone therapy, the 9th of February 2017, the 2 centimeter residual tumor mass that was present before was no longer visible on her MRI. MRIs were done in subsequent follow-ups, namely July 2021 and October 2022, confirming that her remission remained stable. The paper then uses these exact words: "The patient was considered cured." As you've just heard, this kind of result is unheard of in cases of GBM. Even with the best standard of care treatments, a durable remission of 7 years is truly a miraculous outcome. I imagine she's still out there somewhere enjoying life. Now, before we get too excited about this and run around trying to copy her, it's important to keep things in perspective. This is a case report of one person, not a clinical trial or even a case series of multiple patients. Therefore, it's impossible to know if this combination would work for anyone else without further research. Furthermore, we can't exclude the possibility that delayed effects of radiotherapy contributed or that the patient's tumor biology made her unusually responsive. That being said, even if the tumor disappearance seen in the Feb 2017 MRI was the result of delayed radiation effects, the fact that her remission significantly surpasses the prognosis for GBM essentially proves that it was her alternative protocol that did the lion's share of the work. Each of these therapies have individually been tested against GBM with encouraging results. Much of the evidence is preclinical, but there are also many clinical trials using these individually alongside standard therapies with good results. For today, I won't go into all of the mechanisms and benefits of these complementary therapies, as they all deserve a video of their own, but I will briefly mention a few benefits. 1. Cannabis contains biologically active compounds. Most importantly in cancer, they are THC and CBD. In lab studies, these cannabinoids show cytotoxic effects on GBM cells. Research demonstrates that certain cannabis extracts can reduce tumor cell proliferation, inhibit cell motility, limit colony formation, and induce apoptosis in cancer cells. 2. Ozone therapy is more controversial but increasingly being studied as an adjunct approach in cancer treatment. It appears to have the following effects in cancer cells preferentially, leaving healthy cells unharmed. It oxygenates tumors, something that counterintuitively harms them. It disrupts tumor redox balance. It causes oxidative stress that can overwhelm cancer cells, leading to apoptosis, and it increases cancer sensitivity to chemo and radiation. Additionally, patients often report reduced fatigue, nausea, and improved quality of life, an important consideration in GBM care. Melatonin is best known as a sleep hormone, but it also plays a role in cancer biology. It has the following effects on cancer cells. It slows cancer cell growth, promotes apoptosis or programmed cell death, acts as a pro-oxidant in cancer cells, causing oxidative stress, but acts as an antioxidant in healthy cells, protecting them. It is anti-angiogenic, meaning it slows the growth of new blood vessels to tumors. It helps to modulate the immune system. Specifically, it enhances the activity of both T and natural killer cells, which can then target and kill cancer. Finally, it may reduce chronic inflammation that supports tumor growth in glioblastoma. In glioblastoma patients receiving radiotherapy, melatonin supplementation has been associated with improved survival, better tolerance to radiation, and reduced treatment-related toxicity. Its antioxidant and anti-inflammatory effects may help protect healthy tissue but leave tumor cells more vulnerable to treatment. Check out my previous video on melatonin for more on this. It would be wise for future research to examine how effective various combinations of these therapies might be, with or without standard treatments. Thanks for joining me in exploring this astonishing paper. I think we can all be encouraged that the impossible is not always impossible, and that's one of the most important mindset shifts we can hopefully have on a cancer journey. Hope is key in thriving beyond cancer. So hang in there, even in the darkest night, there is always the hope of dawn. If you want a deeper dive into the biology of melatonin, cannabinoids, or ozone therapy in cancer, I'll be covering them in future videos. So go ahead and subscribe so you don't miss a thing. Thanks for watching, and I'll see you in the next video.